can come off mute and let us know that you can see us and hear us?
Okay.
So for seminar on
Yes, we can
evidence-based
see you.
methods, we
I
have
hear you.
2 additional trainees that will be joining us on our teams. The first, Bethany, if you want to come off mute and turn on your camera, that would be great so folks can see you. And just introduce yourself.
Weird.
And even when you move it, it doesn't move.
Yeah, hopefully you guys can hear me. My name is Bethany Cooper. I'm a 4th year student at Wright State University, so I'm working towards my side. And I'm excited to be a part of the different projects going on, getting some more research experience and working together as a team.
Great, thank you, Bethany. And Kavia's at home today, but hi, Kavia, hope you're feeling okay. Thanks for joining. And then we have one more person in the room who I will, let's see, have you guys flip to see her. If you want to wave, Tayana, and if you could speak loudly or, oh, we actually have a roving mic. If you could introduce yourself and tell us where you're coming from and all of that.
Hi, everyone. I'm Tayana. I'm a 3rd year psychology major at UC, and I'm coming from the McNair Scholars Program.
Excellent. Thank you. So we are super excited that Tayana is our 11th McNair Scholar undergrad trainee who has joined us in Lend for SEBM. So my thing that I always say about McNair Scholars is that you would never tell a difference that she's an undergrad and not in grad school because they are so well trained already that they are ready for grad school. So that being said, does anybody have any questions about seminar and evidence-based methods so far? Cool. So what we're going to do today is you'll hear from the 5 different projects, and then either you can do it right away, you can sit and think on it, but you will be able to review all of the slides and all of the Word documents that do an overview of the project's proposals. And then you will complete the survey no later than next Thursday. And then that will give me a couple weeks to mix and match you on different teams. And then you'll find out your team assignment as soon as I get that all squared away. But hopefully, well, definitely before September 22nd, when you all meet together with your teams. So I will have Angel Ehrenschwender is going to present first on a project that is near and dear to my heart. Bethany and Kavia, this look good to you guys?
Yeah, it looks great.
Okay, and there you go, and this works.
Whoa.
I know, right? You fancy.
I'm fancy. Okay, can you guys hear me? Do I have to stand by the mic? Is this like a?
Ish. Just wondering.
Great, I'm gonna hang out right here. My name is Angel Ehrenschwender. I've met some of you. I am a recent Lend graduate. I actually graduated from the program last year. So I was here a couple weeks ago on your first day. I can't get away. You'll be this way next year. Don't worry. And I'm working with Nicole Nighty, who's my supervisor over at Children's, and who is also going to be the public health faculty member. And then Steph Weber lightly works on this project with us and is going to hang out with us, I'm sure. And so our project is kind of, the overhead is the Empower project. And then what we are doing for this SEBM is developing peer support curriculum for pregnant and parenting people. And so just some stats and information. So substance use disorder in general is defined by the DSM-5 as presenting with 2 or more of these symptoms. So using your drug of choice for an extended period of time, using it more than intended, having a persistent desire to use your drug of choice, using despite problems that can be socially, emotionally, time spent seeking, craving, or using, and then not meeting obligations as a result of persistent drug use. And so substance use disorder within pregnancy is an even more specialized population. And so it's estimated that between 7.5% and 9% of pregnant women actually report having a substance use disorder. We believe and probably know that this is underreported because of stigma, because of the considerations that a mom is having when she's going in to get prenatal care or give birth. And so there's a lot of consequences with disclosing this. And then also to kind of connect it to Lend and to where you guys are in the populations that you're working with, a lot of infants born to mothers with substance use disorder may develop neonatal opioid withdrawal syndrome. Some of you might be familiar with NOWS. Also, there could be long-term impacts in prenatal opioid exposure, causing, neurodevelopmental consequences, emotional consequences, physical consequences, just depending. And we see the whole range, it might be nothing and it might be something, a little bit more severe. So definitely depends. But this is the population we're working with. So we specifically work with mom on the back end to try to kind of prevent some of these longer term consequences with baby and so on. And so our SEBM project that we're going to do is we are going to work alongside our Empower Project stakeholders. So this is a group of moms that have given birth and have lived experience of substance use disorder around that timing of pregnancy. And they are going to help us and be integral in the experts in developing this peer support training module that is going to then directly help anybody working in peer support with pregnant and parenting people. And so we are going to equip these peer supporters, so the people that are boots on the ground going out and going into hospitals, going into rehabilitation facilities and all of that, and giving them a specialized like module or curriculum that specifically deals with pregnant and parenting people instead of peer support broad, which is anybody with a substance use disorder. So what is peer support? Some of you might be familiar, some of you may not be as familiar. Mostly it's just individuals with this lived experience that are currently in recovery and are stable in their recovery process and then want to walk others through that recovery process. So they want to help others navigate that process. And so that could be them sharing knowledge, resources, encouraging them, connecting them to community support. This quote is actually from one of our Empower Project partners. And so she is a woman with lived experience. And she said, peer support is, I think, the number one thing to have a voice that's been through it. So as much as we as clinicians and researchers want to think that we're the experts, we are not the experts. We have not lived this. We have not been in it. And these women have been in it. And so we get to kind of lift them up, lift their voice up, give them a seat at the table. And that's what this whole project is how to give those individuals a seat at this table. And so what is the Empower Project? That is what is all of this is housed under. So Nicole Knighty and Steph Weber founded the Empower Project back in 2019. It stands for Empowering Mothers, Providers, and Other Research Stakeholders to Weigh In as Experts in Research. And so it's a collaboration mostly, and the core is these individuals with this lived experience of substance use disorder, and then different providers that would work with this population, community members, and then researchers, with the goal of improving care and health outcomes for the well-being of individuals that are specifically in this perinatal period. And so this is just like some of our work that we've put together. This is super busy. We're not going to get to go through all of it, but this is just one product that we've had from the Empower Project. So this is a result of a focus group with some moms, and the whole goal is to hear them and let them direct the way that research goes. And so this is recognizing trauma and stigma in the patient journey. And so you can see at the bottom, like, patient-centered care is huge. And you're going to hear about that like 100 times this year in Lend. It's just going to be on repeat, patient-centered care. And then just pulling some quotes. So this is just an example of like something that we've done. This project is really cool and it's really having an impact on this population. Our policy partner is the Ohio Mental Health and Addiction Services. So OMAS currently houses all of the peer support curriculum. And so the current curriculum is 20 hours e-based and then 40 hours classroom-based. And so there is an existing peer support module, and none of it, like 0%, talks anything about pregnant people. And so somebody could be fully peer support trained and then get assigned to a, I don't know, participants can now see your applications.
Oh, you're fine. Sorry.
Okay, great. And then get assigned to a client who is currently pregnant, and maybe they are like a 50-year-old man that has never done anything with pregnancy at all. And so they don't have the tools and resources necessary to actually help that person. And so what we're going to do is create a module that is specific for that population, very specialized for anybody that's going to be dealing with anybody in the perinatal period. So project goals would be to work alongside those Empower stakeholders to develop that training, making them the expert, giving them opportunities. We have moms right now that are actually getting peer support trained. And so we actually have 2 moms right now that are like over at Ohio Mental Health, like getting this training so that they have kind of a full knowledge of what is included in the training to be able to say what needs to be added, what's missing, and then as a team, we would develop that training via like these online module videos. So taking what they say and then creating a curriculum out of it, and then pilot that curriculum with our team, people that are currently peer certified. And then we have some connections with other people that have the certification to know like what is helpful, what is valuable, is this working? And then finalize that. And then this will be adopted by OMOS, which is a really cool part of this project, that what we create by March or April-ish is going to be published on OMOS's website, and it's going to be available to all of Ohio for all peer support trainees. So if you want to be on something that you can tell your mom to go look up, it's going to be online, I'll show you what I did all year. So this is our timeline, just to give you kind of an idea, of what this is going to look like practically. So literature search, September, October, just to kind of understand what's out there in terms of like that perinatal training. There might be people that have created this. Maybe they used stakeholders with lived experience. Maybe they didn't, maybe they're missing the mark. We don't know. And then to actually complete that 20-hour eBased Academy and then review, we have like a packet of all the curriculum for that 40-hour, just to know what's in there, just for us to kind of frame a reference when it's being like referenced, we'll know what's in there. And then October and January would be really focusing on developing that new curriculum. And so we have intentions to meet with our Empower stakeholders. It's a group right now of 8, expanding to up to 15 individuals with this lived experience to understand what they want to add, what would be valuable, what we can include. And so you will have the opportunity to either attend that meeting virtually, or you can go back and watch it. We have a private YouTube channel that we're going to post everything to. So if that meeting happens to take place out of that like 3 to 5, Thursday window, and then to develop this content for during pregnancy, delivery, and postpartum. And then we're going to film them. So the cool thing also is that your face could be on this module that then is going to be available on the OMOS website for your mom to go and check out, So it doesn't have to be, if that terrifies you, but you're into this project, like you can just be script writer, you don't have to be on the screen, but it would be really cool to get to, present as a trainee that is going to at some point work with this population. Like, there is just no way that you can get through what you're about to do with your career and not work with somebody who's been impacted by the opioid epidemic or somebody with lived experience of substance use. So, and then February and March, we're going to kind of pilot this. We're going to go to some forums and pilot and get some feedback from some people that, maybe have more insight than we do, and then incorporate that feedback, and then also develop a poster, because we're going to have a poster presentation in April. So that part's awesome. We did that last year. It was so fun. It's here this year instead of in Columbus, which is like even better. I don't know if you know what I'm talking about. Great. Okay, cool. Everybody's going to be like, we have to present. It'll be great. It's awesome. Okay, so what do you gain? An opportunity to work with people who are underserved and often excluded. Most research excludes pregnant women completely because they're considered a vulnerable population. But also most research absolutely disregards anybody with a substance use disorder because they are hard to work with or unstable or, a myriad of stigmatizing things. They're incredible women. I had lunch today with 2 of our women. They are so awesome. They want to work. They want to work hard. They want to be in this, like boots on the ground, like let's do it. And so it's really cool. It would be really sweet to just kind of, maybe change your own perspective, change your own stigma and bias about what these women are capable of. And then learn how to build this adult curriculum model with that patient-centered focus. So instead of coming in as the expert, like considering somebody else the expert and taking what they give you and then building it out. And then on an eBased software. So we're kind of bouncing around some different softwares, and then script and film the training modules that you can then be featured in on the OMOS website. Also, if somebody in here is like really into film, video, tech, like email me, like that would be really cool if you were on this project and you could like own that piece. So that would be really cool. I don't know if anybody is. Otherwise, it's going to be me and my YouTube videos trying to figure out how to now do this. Okay, what do you really gain? Like not so much professionally. Really cool mentors. Nicole is awesome. I mean, she is literally just off the wall, burning down, doing whatever it takes to change research and to change what research looks like. And so she's going to invest in you. Steph obviously is going to invest in you. And also I just graduated Lens. So like, if you want to know, all the insight tips and tricks, join my team and I'm going to give you them for free. Lots of treats, candy, cookies, ice cream. Those are all going to happen at least twice, maybe 3 times we'll get ice cream. I don't know. That's my vibe. Lots of celebrations. This is fun. Blend is fun. And like SEBM probably was one of my favorite parts. I was on Jen's team. So if you pick her over me, like I get it. It makes sense. But SEBM is just a really cool time to like get close with 4 or 5 of your like trainee friends and like kind of build something together. And so we're going to celebrate that. And then all the dogs and the babies and the plants. Nicole's got like 8 dogs. I don't know how many dogs she has. She fosters them. And you guys probably know Easton. I don't know. Has his face been on the screen yet? Okay, good. And then I'm into plants. So if you want to chat, you might get a plant gift at the end. Who knows? I think that's, yeah, okay, great. That's it. Oh my gosh. All right. If you have any questions, email me.
Well, what questions do folks have right now?
None.
The only thing I would expand upon, Angel did a great job summarizing it. The only thing I would expand upon, let me get this, sorry. Really quick.
Oh yeah, okay, get the mic.
Make sure the ladies on the Zoom can hear me. The only thing I would expand upon is the curriculum will have a great deal of content related to anticipatory guidance on what to expect around having a child, particularly a child that has been prenatally exposed, and what little research we do have. It's a very young field on neonatal abstinence syndrome and NOWS. But what we do know is that these kids definitely often need OT. They often need behavior support. And they often have sleep and feeding issues. So I think just keeping those kinds of things in mind, that a lot of that content around early childhood development is really interesting. And how do we build a module to help people and get educated, a whole cool population that we don't normally get to engage with. So, and I don't know, Caitlin, they always have torticollis. At least Easton did. He was like, hey guys, how's it going? I'm cute. I'm not posing. I just am stuck this way. So yeah. All right. Well, I think that's it. Yeah. Go ahead, Caitlin.
Yeah, no. The peer support, like actually doing that training module, is that something in person?
So the 20 hours is completely online and we will probably break that up.
I was going to say that would be your whole SEBM semester.
No. It would, there's 11 modules. So it would be like, you get 2, so-and-so gets 2 more. I'm going to do 2 more. And then we would kind of report back about what it was about. And then that 40 hours is in person. So we won't do that. It's a booklet. So we'll just like kind of flip it. Same thing, split it up and kind of summarize, what's in there and what do we think is missing. Yeah.
Yeah, that's a good question. The 40 hours, like we tried to take it and the state said, well, are you a person with lived experience of substance use disorder? And we said, no. And they said, well, then you can't be part of it just to be a fly on the wall because it's so sensitive. And it is really for people with that lived experience to learn from each other and to get that training.
Yeah. I think the majority, I meant to say this, is going to happen between 3 to 5. There might be a random, like, hey, we're filming today in the morning, or like something strange. But I think for the most part, we're going to try to do it all in that 3 to 5 range. And like I said, like meetings that are happening outside, we will record and you can go back and watch them later. So somebody on the computer is speaking to me.
Yeah, I had a quick question because I know you guys were talking about the population in general. Are you guys also including like alcohol exposure prenatally as well, or just sticking specifically with the neo abstinence syndrome?
Bethany, great question. I would say we're not opposed to incorporating all substance use disorder exposure, like all substance use disorders and prenatal exposures. I think some of that will be guided by our project partners. And so there will likely be some fetal alcohol spectrum disorder information, but predominantly the folks and the reason that we got this support from the state was to focus around the opioid crisis. But we know that most children aren't only exposed to opioids, like very few are exposed to only one thing. And that is oftentimes not opioids alone. So I don't think that we will be avoiding by any means fetal alcohol spectrum concerns. But we're gonna have to kind of see how much time and how much content will fit in. So, and that could be something that we say, oh, you know what, OMAS, we need another year of funding to help us do one particularly on FASD. So,
And I think I said this, maybe I didn't. It's a 3-hour training that we're developing. So 1 hour on during delivery, 1 hour, or I'm sorry, during pregnancy, 1 hour during delivery, and then 1 hour for postpartum. So 3 separate modules. I don't think I said that. I said it now. Awesome. Great.
Thanks, Angel.
Thanks, guys. Join my team.
I don't know, I'm fun and young.
awesome. All right, I'm gonna stop share these slides, pull up the new ones. Ooh, Jen.
What?
Oh, there it is. Okay. I don't know. They just, are these not in PowerPoint? Whatever you sent me.
Oh, you know what? I sent the in PDF because of pictures
Yep.
being so big.
So are you okay
It's
with doing
fine,
this?
yeah.
Okay, cool.
Yeah,
I
it's
think
good.
if you,
I might just have to,
hold on.
can I do this guy?
Yep. You're gonna have to, because otherwise it's gonna be weird.
Okay.
Okay, let me share.
Yeah, I have a lot of pictures.
Yeah, you're gonna have to use that one.
Okay, that's fine.
Cool.
Hi, everybody. I am excited to share a project that I've been working on for the last several years. And Kara Ayers also co-leads this project with me. So she is not able to be here today because she's in Columbus at a meeting, but I will do my best to represent our team. So the title of our project is Access to Inclusion. Like Angel mentioned, she was on my team last year. And what we are really trying to do is make Cincinnati the most inclusive city in the United States for people with developmental disabilities. And one of the ways that we are doing that is with this year's project. So like I said, we've been doing this work for a couple of years now. And I'll just kind of give you the backstory really quickly about where this work started. So several years ago, we were contacted by the folks at CVG Airport because they were interested in developing a program to support individuals with ASD and their family in the flying process. So they reached out to us and the folks at the Autism Center or Autism Society of Greater Cincinnati as the autism experts in our area. So we started a program called SOAR, Starting Our Adventure Right, that is the program that started at the airport to have practice flights at the airport for families to be able to get on an aircraft and be able to see how their loved ones did. And then also a staff training model that we developed to train the staff that work at CVG. And then also a lot of cool visual supports that helped prepare the kids for air travel. So that was kind of the origin story of the SOAR program. What is really cool is that since that time, we have been able to work with so many partners across the greater Cincinnati area. So this is just a slide that shows all of our partners. So they've done a variety of different things, including events and staff training, camps. So since we have been working with them, Macy's has been like a huge supporter of our work. For the last several years, they have gifted us money to be able to do this. So we're extremely thankful for the Macy's support. Since we had that first CVG event in 2013, we've had over 30,000 people attend our events, and we've trained over 2,800 people out in the community on community inclusion and how to support people with developmental disabilities. And this is just a slide that shows one of our biggest success stories. So this is a little buddy. He's not little anymore, but his name is Ryan, and he attended our first SOAR at CVG, and he was terrified to get onto the plane. But he was a trooper, and he and his family did the program several times. And then this picture here is a picture of his family at Disney. When they were able to travel together as a family. It was the first time that he had ever flown on an airplane, and the mom sent me a video of takeoff, and it's like one of my biggest professional accomplishments. Because in the end, what we're trying to do is face some of the barriers that face our families and help our families be included in everyday life. And so this is just kind of an example of kind of where we've been so far. But we know that a lot of the public venues that are kind of working on this are still not necessarily inclusive of people with developmental disabilities. They may follow the physical accessibility requirements as guided by the ADA. But we all know that there's a difference between physical access and being actually included in community spaces. So when I borrowed this from Dr. Weber, because it got me thinking that that's basically what we are trying to do from a justice standpoint, is remove some of the barriers that these organizations face, because true inclusion really does remain an exception. And a part of that is because these organizations, they don't know how to do this work, and they don't have kind of a guidebook or professional standards to be able to follow in order to do this type of community inclusion. So our vision is to transform our greater Cincinnati area into the most accessible and inclusive region in the country for individuals with DD and their families. And we also want to serve as a national model. So we have a really sweet thing here in Cincinnati, and we think it's something that other programs across the country would be able to apply as well. So how we plan to do this is by developing comprehensive standards that community settings can follow. So if you think about what's like a LEED certificate with green buildings, and some buildings will get like a certain level of certification. That's essentially what we are trying to do, is develop these standards so that these companies know exactly how to approach community inclusion. So we are working with our community partners that we have in the past, and also working with our Family Advisory Council within our division here in DWP, and then also with the founder of, it's now called Eloquate. It used to be Queen City Certified, but it's a gender equity initiative. And so we have very similar kind of purpose in mind, that we want, you know, our locations to be as equitable as possible. We just focus on developmental disabilities, where she focuses on equity. So our team meetings will be primarily in that Thursday 3 to 5 time. Any time that is needed outside of those times will be flexed. So that is something that may come up occasionally. And the MCH leadership competencies that we really focus on are obviously the family and professional partnership, policy, working with communities and systems, as well as interprofessional team building. So I'm going to give you a kind of a background of where kind of each of the SEBM teams has been in this journey. So in 1920, that group reviewed the ADA guidelines and the literature that was out there, and did an environmental scan of the regional websites for each of the ADA regions across the country. And then also consulted with partners to be able to identify, okay, where are the gaps in this type of work that we really need to be thinking about. And then in 2021, the group started to really dig into the evaluation standards and starting to look at how do other places do this. You may have seen on like preschools or early child care centers around town, they have the stars and they have, like the level system. So we started to look at that as kind of a model to say, okay, we are going to develop this scorecard to be able to use to evaluate these places. And what we focused on in that year is really looking at the professional side of the family professional partnership, because we wanted to know what was out there in the literature and kind of what was being done kind of in this space. And then last year, we really focused on the family aspect of the family professional partnership. So we partnered with the DWP Family Advisory Council to draft a survey. And then we were able to create a draft of a survey that looked at different places within our community, because all places are going to have a little bit different aspects of inclusion that are important. So we looked at certain places like restaurants, places of worship, places of retail, entertainment spaces, and really tried to make our survey accessible and being able to complete within a 20-minute time frame. And that survey is living in Red Cap. And so we, for this upcoming year, what we are going to do is submit for IRB approval, collect data from family members of kids who have developmental disabilities and adults. So advocates themselves who have disabilities, because we want to have both of those perspectives and combine that and analyze the data in order to improve that scorecard and to make those changes. So that way we can really prioritize what's important to the families and the individuals, and combine that with what we think is important as professionals and kind of have the full package. So opportunities for trainees this year, we will be revising the protocol. That will be kind of our first step. Angel rocked it last year, and so we need to submit it to IRB for approval, and then refine the survey. We had waited on our survey because we were waiting a little bit to try to get out of COVID a little bit more, thinking that families' experiences may be really influenced by COVID and they might have more isolation than they typically do. So this year we will be sending out the survey to families and advocates. We'll analyze that data and then improve that scorecard. And the scorecard is in a couple of different sections. So trying to think about true inclusion for our population. So those are some of the things that you would be doing within this project. The other thing is just being a part of something really awesome. So Lisa, shout out to you, because she's actually helped with a couple of events before. And Angel is in here. So we have the partnership with the barbershop, with the Cincinnati Cyclones, with the zoo. This was at a monster truck rally. And here I am with the Queen of Cincinnati, Fiona. It really is something that we are extremely proud of. And the thing that I would tell you all as well is, even if you decide that you are more interested in another project, you can always do stuff with SOAR. So for any events that we have, I always send out an email announcement through Canvas that tells you the events that we have coming up for the next month, and that you can volunteer for those events. But this is kind of a more intense, or not intense, but a more in-depth look at community inclusion by being a part of this project. But like I said, we hope that everybody can be a disability champion and really helping us kind of make Cincinnati the most accessible and inclusive city. And if you have any questions just in general about SOAR, reach out to me. And then this is also the work that Katie is going to be doing as a part of community engagement. as a part of her LEN traineeship as well. So that is the information that I have to share about our project, but I would love to see what questions folks have either in person or in Zoom land. So we'll open it up for questions. Okay.
Do you have any idea how many like participant surveys you'll be getting back? Like, is it going to be 40 or like?
Yeah,
how many invitations are you sending?
Yeah, so that's a good question. From a methodological standpoint, we are going to open it up and have it be blasted through like all of our social media. And the thing that we're restricting is that we'll have it be based on people that live kind of in our area, because we want this to be more centered on Cincinnati first. And so and Angel, you'll have to help me with this. I know we worked with Nicole Mighty last year to do kind of a power analysis to see how many surveys that we would need to get, but I think we'll actually get like hundreds, I would imagine, and be able to have a really good sample based on just previous experience of like family involvement in this type of work. And one of the things I didn't mention on here is that we'll have the survey and we'll have the Family Advisory Council within DWP take the survey in order to give us feedback before it gets sent out to the general public. Good question. I think there's, yeah, Suma.
You know, like when you anticipate like this, like kind of like a timeline, like when the survey will go out and when we would get the results?
Yeah, so that's a good question. Kind of timeline wise, what we're hoping is that the IRB will be pretty quickly accepted or approved. And then we will be able to send the survey out. We're thinking like this semester, and then be able to analyze the results next semester. Yeah, good question. Okay. All right. Well, I'm not as young as Angel, but I'm fun. So. Okay.
All right, and then it looks like Ann Tapia and Dr. Amy Duncan have arrived. So I am actually going to let you all share your screens and introduce yourselves. And I'm actually going to flip this around so you in Zoom land can see them, right? Oh, Amy, are you on vacation? Oh, you're
muted, Amy.
Or are you just picking up the kids?
I'm in between things, you know. So,
okay.
Hi, guys.
Yeah. Oh, thanks for joining us. Be safe.
Yeah.
Awesome. All right.
All right. Hello, everyone. Thank you for hearing our pitch. We'll take a second here to do a quick intro. My name is Ann Tapia. I had a chance to kind of introduce myself quickly the other day, but just a refresher. My role is the coordinator for the Regional Autism Advisory Council, and that means I bring together stakeholders in the autism community so that we can resource and network and then find ways to address the many, many gaps that exist in our community. Amy, you want to intro?
Sure. So hi, everyone. I'm Amy Duncan. I am a psychologist, and mostly what I do, I've been doing SEBM for like something like 9 years or something, which is wild. So I love this and keep coming back. But what I do day to day is I primarily work with autistic adolescents and young adults, and I am primarily research right now and really work on developing and evaluating interventions to help with the transition to adulthood. So excited to work with some of you.
All right, so our project, we are focusing on adults with intellectual and developmental disabilities, and specifically with healthcare. So a little bit of background here. This is a second-year project, and the kind of why behind it, we have some data here to show you. Now, this data is specific to autism, However, we know that this is not a unique aspect of the autism spectrum disorder, that other adults with disabilities have very similar poor outcomes when we look at these various categories of life in terms of what happens after high school. And I mean, I'm not going to read this to you all, I'll let you all look at it, but the big bottom line is that folks are not engaged in the aspects of life that our neurotypical folks are in the same ways. So that goes across categories of education, employment rates are super low, housing, very few live independently, and then from social aspects, there's just very limited. And then as we think about that, those kind of life categories, that all impacts our health and our health outcomes. And so when we think about access to healthcare in adulthood, it's very different than what children are used to receiving. You know, in Cincinnati Children's System itself, there's just so much that gets wrapped around the family and the child themselves to ensure that their holistic needs are being met. When you move into the adult system, it's really on you to coordinate that care across different disciplines and ensure that your needs are being met. And many folks with disabilities have co-occurring disorders. Sometimes that's health related, sometimes that is mental health related. But at the end of the day, we all need our regular primary care physician and all of those other doctors coordinating, ensuring that we are holistically being addressed in our healthcare. I'm sorry, Amy, what do you want to add to that? I was thinking we had one other slide in there around the data.
I think that covers it, and I think it's just a huge issue and there's not a lot of services or supports to address it.
And I think, you know, one of the challenges in our project that we kept going back to last year is that, you know, unless folks are resource rich and they know how to navigate systems, people are really falling through the cracks in terms of being able to get their needs met in a way that's truly, you know, providing the kind of care that leads to a quality of life. So our project last year was focused on the Freeman Center. The Freeman Center, for those who are not familiar, is a healthcare program that is out of University of Cincinnati Health. And it currently exists in a way that up until about like December 2021, right into the early 2022, it was called the Transition Clinic. And the idea was that people would transition from kind of higher levels of care at Cincinnati Children's into this clinic at UC Health, and they would help to identify practitioners in the community that could meet their needs. What was really happening, though, is that people would transition in and say, we don't want to leave. There's either our community practitioners are telling us that they don't have the capacity to serve us, they don't know our disability in the way that you do, or they just said, I'm comfortable here and I see no reason to go anywhere else. And so it led to Dr. Wong and Dr. Timothy Freeman saying we could build this center into something more. And at the end of 2021, Dr. Freeman passed away. And so the center was named in his honor, the Timothy Freeman Center for Intellectual and Developmental Disabilities. And so the idea is to really enhance what's currently provided, which has been focused on primary care, psychiatry. There's some nurse care coordination and social work that has been added, but really in kind of a aside to what other services are there. And they know that there's more that could really be addressing the needs. And so they would like to grow it into these additional services that come in, really targeting the primary disciplines that are often higher in the co-occurring disability areas. And of course, those areas where everybody, all women, or all people with female body parts need to go to the OBGYN, right? And so some of those kind of primary disciplines being well coordinated, that, you know, shocker, the doctors talk to each other about the care that they're providing, and they collaborate with one another in the ways that they're providing care. In addition, growing some of these other areas of care that otherwise people are having to find in piecemeal and being able to offer it under one house, under one umbrella. So last year, the idea was really trying to figure out, well, last year, I should say, we pivoted a lot, but what we ended up doing was focusing on figuring out what this center could offer from a care navigation, care coordination kind of standpoint into this role of a community navigator, and trying to figure out what would a community navigator do that would be different from a healthcare perspective that other care coordinators that are already in the community don't do, and really trying to identify some of the gaps within the community. And with that, we gathered resources and developed a resource directory that the community navigator can use. And the community navigator is almost a real thing. There's currently a person who is in that role in a contracted position and has 2 years of funding. So what they're asking us to do this year to expand upon this is to help them figure out how data can tell the story that really justifies the need for community navigation. I'm going to stop and ask Amy, is there anything I'm leaving out there?
No, I think you covered it. And I think whoever's on our project, we can share all of that information with you that we've already developed. So this is sort of like part 2 in a sense, but it's really building on, and Anne mentioned we pivoted a lot. I think that's just very real world. This clinic is new, it's starting up. And so, we kind of had to say, what do you need? And so in kind of formulating this project, that's really where we started. It's like, what do you need to help build this clinic? What are the next steps? And so what's cool is, you would get to really be a part of that, which is, a novel thing. I think it's been a novel thing for me to kind of see this go from idea and it's real and it's happening. So just kind of an interesting piece to be able to be involved in something like this.
I can say this year, I feel like our direction is far more defined. We know the direction we're going, and there's some tangible things that we can do with it. And we're focused on this data aspect. So we really want to ask, so I have our questions here. We want to ask, who is currently being served at the Freeman Center? And then who is not being served at the Freeman Center? And what picture does that tell us? And with all of that data, as we can take this de-identified information and summarize it in some, beautiful ways that tells the story that then the Freeman Center leadership can take to stakeholders, which may be community members, but it may also be potential funders who will need to understand how they're operating, how they intend to grow, and how the funding could be benefiting that growth, as well as meeting some unmet needs that currently exist. The other component that we're looking at is, so the data we're going to pull will be coming from Epic and de-identified. We won't have any client information that we're working with, but that won't tell us everything that we know we need to know about the people who are there. So for example, currently when you receive healthcare services, it doesn't, some of the information collected there is not including whether or not a person has a waiver, which means they're connected to the County Board of Developmental Disability Services. And it doesn't say, what other services that they're accessing. And so those are some of the things that we feel like our team can be helping to develop a screening tool that the staff at the Freeman Center can utilize to gather some additional information that would be helpful both in this moment where we're helping to justify the need and find some funding, but also to tell a bigger picture of the lives of the people who are being served. So we'll both develop that screening tool with them, as well as a tracking system to help them take that data and make it a cohesive story that can be told. Go ahead, Amy.
Okay, sorry. I was just going to say too, I know you mentioned the sort of the products that we're going to develop. And so a lot of that will come, potentially from who is underserved, who are they serving versus not serving. But I know we showed you that pretty infographic from Drexel Autism Center, which does an amazing job of doing that. And we really want to help tell the story of who's coming in, what do they need, but also how do we help, where are they going to go next to kind of help the community navigator do that. So if you've got some artistic skills or you're good at things like Canva, that could be a value add in this project in particular.
Or other formats that we aren't thinking about. That was one of those that Amy and I were like, well, let's not just say the word infographic, because maybe you'll have some brilliant idea that we haven't even thought of. So, you know, we're very open to how we can creatively paint that picture. So what are you going to do? One, we will help to grow the understanding of what the needs of adults with intellectual and developmental disabilities are. We'll start off by doing some lit review of the community navigation role and really understanding what is the function of that kind of purpose from other, you know, evidence-based research that has been done in other, sometimes in the same field, because that has grown in the past couple of years, but sometimes in other fields as well, how other disciplines use community navigation. We mentioned that gathering and analyzing the de-identified data to look for trends, find those underserved populations, summarize that information into something clear, accessible, and readily able to share with stakeholders. And then finally, developing that screening tool and tracking system. We have amazing policy partners. So Dr. Lauren Wong, who I mentioned is one of the key spearhead of this initiative in general. She is incredibly busy and yet still very willing to make time to be part of this process and help to inform and shape the work that we're doing, because it ultimately benefits her anyway. And then Christy Gregg is the current consultant, title in flux. So she'll probably say something else in her introduction. But ultimately, the intention is for her to grow into that community navigator role as that funding becomes more sustainable. So she has a very vested interest as well in the work that we're doing, and will be highly involved in making sure that we're doing the work that makes sense, as well as her being an LEND graduate from last year's class, and can definitely empathize with you all in the process of what you're going through and be supportive. And so she is definitely a part of this project as well. Another key piece that I didn't put on this slide too is that we may need to talk to some family members as we're developing that screening tool, and really be thoughtful about how we ask the questions, because we certainly don't want to create harm or potential problems in that care process that they're there to receive, right? They're not there to give us data, they're there to receive care for their loved one. So we'll want to be sure we're doing that in an informed and culturally sensitive way. And then logistics. So we will primarily meet on Thursdays between 3 to 5. If there is some outside work that we're doing, we will definitely flex that time as needed, honoring that, you know, you all are busy people and this is not the only thing on your plate. We will mostly do remote work, although we'll certainly schedule in person as we as a team determine that's needed. And we will definitely do some in-person celebrations. So if you want to come have some fun with us, you should join our group. Amy, what else am I missing?
I think that's everything. Nice job, Anne. Yeah, I can't think of anything. I guess if folks have questions, we can answer those.
Let's open it up. What questions do y'all have?
Any questions?
I will say that all of our SEBM trainees from last year are still involved in some capacity with the Freeman Center. So I know that it sounds like data is kind of boring, but there was a ton of passion that grew out of this project that has grown into bigger things that folks have stayed involved with. So it's a fun crew.
It is. And a unique topic. It's nice to see what happens after adolescence, right? And what that looks like, what the unique needs are. So it's definitely a different sort of training opportunity to get involved. sorry to interrupt. I think that was staff.
No, I was just gonna say, Amy, I'm surprised you didn't mention your connection to a local brewery. You usually do that.
Well, yeah, I'm happy to. So I was gonna say, so our family is one of the owners of Mad Tree. So one of our in-person celebrations will I would say definitely be at Mad Tree or Alcove, which is our new downtown restaurant, beautiful space that Jen did an amazing training there for the staff there. So building on her last presentation, I just really cool to kind of see that come full circle and the, just the staff there so very much appreciated it. So yes, we will definitely, if that sweetens the pot to get some folks on our team, Ann and I are happy to throw that out there. So I will also say, even if you've never done adults, they're really fun. And it's just sort of a really unique opportunity. So I can't say that enough. Most of the trainees I work with, even with adolescents, are like, this was really cool, and not always a population you get access to. So yes.
Great. Thank you, ladies.
Thank
Appreciate
you.
it. Yeah, and
Let us
Ann,
know if
I
anyone
was
has
here-
questions.
Yeah, definitely. I'll make sure to put everyone's email addresses also in Canvas so that they can email you with questions as well. So awesome. Well, thank you guys. And I think we'll take a 5-minute break now, stretch, get some snacks in the back, what's left from orientation, fill up your water bottles, and then we'll come. All right. And then Allie, if you want to go ahead and share your slides, or Lisa, whoever, I assume Allie, you're going to do it.
Will do.
And you guys can see the audience. So if you want me to switch it, I can.
All right, let me see. Nope. Oh, so I got a new computer yesterday, and I have to enter some settings to grant access to Zoom to share my screen. So please pause for one moment, but while I'm doing that, I can introduce myself. My name is Allie Fisher, and I am a 5th-year doctoral student at the University of Cincinnati. I am a former LEND trainee, so I participated in LEND in 2020 and 2021, and I just haven't left since. So it looks like I'm going to need to close out of Zoom and reopen it. So while I'm doing that, Lisa, would you like to introduce yourself? So I will be right back.
Okay. While Allie's coming back, hi everybody, I'm Lisa Hunter. I'm the audiology faculty, and I'm the 11th year student of LEND, having joined just the year before Steph and Jen came on. So it's been fun to see the journey, and I'm really excited to join Allie on this team that she created, and we'll be hearing about that when she comes back. But my role will be to help with some of the stakeholder meetings that we're hoping to do later in the year with this project.
There we go. And so while Allie's logging back on, I will just say, obviously, you've seen a theme so far with our projects that former LEND trainees don't ever want to go away. So you too can lead an SEBM team one day, which is very fun. And so, yeah, definitely be thinking through your projects this year that you end up being assigned to, or other projects that you see. Like, we love feedback. We love to keep you all involved. So don't hesitate to reach out with your research ideas. And that's kind of what we do, is we try to make sure that we are responsive to your learning needs, but also your future research endeavors. And especially for Suma and Maria, if there's something that you guys could carve out for your fellowship project, let's not reinvent the wheel, right? All right, Allie, you good?
Yeah, so this is my 2nd year leading or co-leading an SEBM group. And in this group, Lisa and I will be looking at racial and ethnic disparities in the diagnostic process of autism. And the focus of this year's process will be a little bit on recruitment. So recruiting some families to complete a survey about their experiences with the diagnostic process, and then dissemination. So really working with community partners to get our research out in a way that is accessible and inclusive for different audiences, and really thinking through how we want to disseminate or get this research out, and kind of getting some feedback in the process from community partners. So we are very excited about this year's project. So we already introduced ourselves, but we have a huge team sort of in the background. Some people will be working on the project actively this year. Some of these people have worked on it in the past. We have in this picture our SEBM group from last year, as well as some developmental behavioral pediatricians who's provided some consultation on the project, as well as Autism and We, which is a nonprofit organization for families of color with autism and other developmental disabilities, who has also provided some feedback and given us some help on this project. So we have so many different collaborators, so many people we work with, and so many different heads in this project, which is wonderful because I love working on a team. It's how we get the best information and figure things out. So to give a little bit of background on this project and how it sort of got started, I was a LEND trainee in 2020 and 2021, and I was really curious in diversity, equity, inclusion, and justice, and really with my experience doing evaluations with families, autism evaluations specifically, I was really interested in how diverse populations experience the diagnostic process. What is it like for them going through this process? Experiencing other challenges like systemic racism, like cultural differences between providers and themselves that maybe providers aren't really understanding or thinking about or addressing. And so what I did first was I looked to the literature. And so we found that there are large disparities in this diagnostic process. So and then also in subsequent treatment use. So we know that families of color and children of color are less likely to obtain treatment services. So this is across the board, things like speech therapy, audiology, OT, PT, behavior therapy. And there are so many different reasons and barriers why families are not able to access these services. Specifically related to the diagnostic process, children of color are diagnosed later than white children. And this is a really big issue because we know that early intervention for these children is so important to improving outcomes, improving their trajectory. And so this later diagnosis is a really important piece of the puzzle here. Also, families of color are less likely to have culturally responsive treatment. So families say things like, well, when I brought up concerns about how my child wasn't talking, was walking kind of late, wasn't giving me eye contact, they say things like, well, the providers didn't really respond to my concerns, or they kind of brushed it off and were like, they might grow out of it. I think it'll be fine. Let's wait and see. They also have said that providers didn't spend enough time with them. They also were more likely to say that providers didn't respond to their family's values or cultural values and beliefs. And then I also met with, as I mentioned, Autism and We, the nonprofit organization. And meeting with them, I heard some of their experiences with the diagnostic process, and they were saying really similar things as what was documented in the literature. So they were saying things like, they were not given the same information or as much information as white families. They didn't feel super confident on what to do next after receiving the diagnosis. So there wasn't a lot of follow-up communication on, here is this life-altering diagnosis. So what do we do next? And so taking all of this information into consideration, we created this project. This has been sort of a multi-year project. This project is also my dissertation, so that's very exciting. And so the goal of this project is to really better understand racial and ethnic disparities in this diagnostic process of autism. There's some broader focus of this project there are a bunch of pieces to this project, but the SEBM project is going to focus specifically on, well, what kind of information are families receiving during the diagnostic process? And then we can figure out, is this impacting how they're getting into services, when they're getting into service, if they're getting into services at all. And so what we have actually already done is we have looked at families charts from 2018, and we looked at, well, what kind of recommendations are they getting in their reports? Are families of color getting recommended to the same services as white families, or is there a difference there? We've also looked at referrals. So recommendations are basically just what's written in the report. So that would be like a provider saying, I think your child should enter into speech therapy. I think that would be really helpful for your child. And then a referral is, did they actually place that order in to the medical chart review to get that process started? So we're also looking, in addition to the number of recommendations, we're looking at differences in number of referrals as well. And then finally, we're going to look at what information they're receiving, AKA the recommendations and referrals, does this then contribute to the number of services and the type of services they received? So we need to really figure out, are they receiving the same sort of information? Because if they're not getting recommended services, how do we expect them to enter into these services or get services for their children? So that's the focus of this year's project. And there are so many different avenues that we can explore. But this is what I thought we could focus on this year for the SEBM. I'm also open to our team, whoever our team is. I hope you all want to join, but whatever your guys' ideas are to sort of add on and build to this project. And then what we're going to do is we're going to take the data that's already been collected, and then we're going to spend a little bit of time analyzing it and figuring out, what are these differences? And then we're going to spend a lot of the time connecting with different community partners. So we're going to talk through who in the community, what groups might be interested in hearing our results, and providing feedback on what those results mean to them, what those results mean for how clinicians maybe should do things differently. And so we really want to, take a lot of this project, creating presentations for community partners and presenting to community partners and getting feedback. And so it's going to be a very hands-on project where we're going to hopefully work with a lot of different people. So if you like working with people, if you like talking to people, if you want to gain some more presentation skills, this would be a really awesome project for you. So I already kind of talked about what's been done. So we've already collected the data. We just need to analyze it and put it together in a presentation. So here's what we hope to do for the timeline. So as I mentioned, it would be awesome, I think, to have you guys do a little bit of recruitment. So collecting some additional information from families on this part would be on their satisfaction with the diagnostic process. So how did they feel about the diagnostic process themselves? And then we'll be doing a little bit of data analysis there. And then November to February, we'll hopefully be planning out who we want to work with and how we want to get this information out. And then March and April, we'd be really focusing on scheduling all of those meetings, presenting to community partners and getting some feedback. So really the biggest aspects of this project are connecting with families and recruiting families to understand their satisfaction with the diagnostic process, planning out presentations and how we're going to convey this information to community partners, and then actually conveying the results to community partners. So the competencies that I think are really important to this project that you guys are going to gain some great experience on are ethics. So some of the questions that might come up is what information should we be sharing with different groups? How should we be sharing this information in a way that is accessible and understandable. We will be working with different disciplines, so we will likely be different disciplines, and then also our community partners will have different backgrounds and different places that they're coming from. As this project is really focused on race and racism, I think cultural humility is a really important part of this process and of this project. And then of course, critical thinking skills. So we're going to really be on the ground, figuring out what these results mean. And that requires a lot of critical thinking and really tying our results back to what we've heard from community partners in the past and what we've learned from the literature. In terms of time commitment, we'll meet mostly at 3 to 5. There may be some opportunities or some weeks where maybe we can divide up tasks and everyone can do their work on their own, for the same time commitment, that 2 to 5. So we wouldn't be working extra. We would just maybe not be meeting, but doing some doing some work on our own. But for the most part, we'll probably meet together from 3 to 5. We'll probably have, snacks lots of times. I don't know anyone who owns a brewery. Well, I guess I know Amy Duncan, but I do not own a brewery. So, that might be a not selling point of this project, but my house is always stocked with beer and wine and snacks. And so we can also do some meetings at my place. I have a dog, his name is Obi. So I think it's going to be a really fun project, but also a really important project that could have potential meaning to people, to clinicians who are working with these populations. And here are the references. Do you guys have any questions?
Yeah, Suma has a question.
Is there any literature review that needs to be done?
I don't know if you could hear. She asked if there is any literature review that has to be done by this year's team.
If that's something that someone's interested in, they can definitely carve out some time during our SEBM to continue to dive into the literature. I've actually done a lot of research in this area. I've written a systematic review about this area, but I think if someone was interested in it, updating the literature and getting more information is always a wonderful thing. If someone wants to gain more literature review experience, I'm really open to all experiences people want to gain. So if there's something you want to get out of this year, literature review, recruitment, if you wanted to do something in the medical record, pull out another variable, if you wanted to, we're open. I hope that answers your question and maybe adds a little bit more about.
And I think to Suma's point, we wouldn't throw you into any project without giving you more than just what you're hearing today. So there will be time at the beginning to kind of dig into Allie's systematic review and read through that and really kind of pull those pieces out for yourselves, for your own knowledge, obviously.
Mm-hmm. Yeah. Definitely. That's an excellent addition, staff.
Other questions? Cool. Thanks, Allie. Thanks, Lisa.
All right. Join our project.
Awesome. And then Allie, if you stop, oh yeah, you did it. Okay. And then we'll have Karen share your slides.
I'm gonna share my slides.
And while Karen is doing that, I'm Karen Burkett. I'm grad nursing trainee. Hello, everyone. Trainee.
Lifelong learner, right?
I've been a trainee twice, like several of us. We love and learn so much. We go through it again and again. Anyway, so while she's doing that, I wanted to share that Steph or Jay, I'm not sure who ended up getting that email.
Oh, yeah. I have it.
You have it?
Yep, back here. Thank you for
Thank
the
you.
reminder.
Okay, great. Good visual cues. You know, I'm sorry we couldn't bring the snacks today that some of the really cool groups do. So we're bringing you evidence of the toolkit that we've already developed and we want to disseminate further, improve upon, and build some multimedia approaches to the project that we have. So what Steph is or Jay are handing out, I wasn't sure who's doing that.
It was me, Karen.
Okay, thank you.
We got one going on one side of the room, one going on the other side of the room.
That's exactly what I wanted. So you're looking at the toolkit that in our past projects we've developed and with the input of parent policy councils at Head Start. So there has been family input, teacher input, healthcare provider input into these toolkits. And so what I'm going to first talk about is the reason why there's a need for this kind of work. And then Karen's going to bring us home with what are the LEND roles and what are some of the projects or what are some of the topics that we've already covered. Karen, I'll let you introduce yourself.
Hi, I'm Karen Harpster. I am an occupational therapist, so I'm down on the 4th floor, and I've been a part of LEND for quite a few years now too. So we're happy to present this information to you.
Okay, so that's our title, Multimedia Developmental Toolkit for Head Start families, teachers, and healthcare providers. And Head Start is for families with low income, so that they can provide early intervention between the ages of 0 and 3, and then preschool between the ages of 3 and 5 for children in families of low income. These are located throughout all of Greater Cincinnati. There's something like close to 40 schools that provide Head Start services or Head Start centers. It's a combination of both. Some are in a preschool where they have a couple of Head Start classrooms, like in an elementary, some are in an elementary school where they have a couple of Head Start classrooms. Others are in Head Start centers like Langdon Farm or Ted Berry. Those are large Head Start centers. Head Start offers early childhood education in the home and in a school setting. Even for the kids 0 to 3, they have occasional in-person enrichment that they provide for children during early childhood. And the reason for the project started with the recognition that 1 in 6 children will have 1 or more developmental disabilities between the ages of 3 to 17 years. And so in order that children can be identified with developmental disability, it's important to do that early. And so often preschool is the first place that recognition that there's a developmental concern comes up, and certainly in healthcare, in well child visits or other types of visits that the children might have in their healthcare arena. And study after study demonstrates that when identification occurs early, ideally between the period of 0 to 3, but certainly that period of 3 to 5, the better the outcome, right? And there have been studies that supported that children who receive early intervention services, whether it be healthcare services such as speech therapy, occupational therapy, motor therapies, behavioral therapies, that the outcomes can be improved. There is evidence in the school system that children who receive early interventions are less likely to need special education and can be in general education placement instead with some services. And there's evidence that therapy services can improve communication, can improve motor skills for children with developmental concern, and even improve cognition. What we found in looking at our, go back one if you would, Karen. What we found in looking at our big data was that about 90% of those children in Head Start with developmental concern don't need special education interventions, but could benefit from evidence-based healthcare treatments, starting in speech therapy earlier, starting in motor therapies earlier, starting with behavioral interventions on an earlier basis. So that's why we're here. We're trying to address those kids who may not need the full IEP, but families want to enrich their development in multiple ways. Next slide, thanks. And so you've heard about some of these barriers already from Ally's wonderful presentation, and our projects are so related. And I cringe that we put caregiver factors first in terms of being a problem to the barriers. There are multiple barriers to why children in Head Start don't get identified or receive services early. One of the primary barriers to that is number 2, healthcare factors. And so, like Ally said, with reduced healthcare access, with low primary care referral rates, you heard Ally talking about families bringing up concerns and those either being dismissed or not noted, or a wait and see attitude sometimes can occur with providers. And then with families not getting all the information or inadequate resources in order to track referrals, that can occur on the healthcare side of things too. There are intersecting factors, and that's what we're trying to address in part with this project, is helping to link communication between healthcare, early childhood education, and communities. Other factors that can bleed into why there are barriers to early treatment is that early identification may not occur if the family doesn't have knowledge of signs of developmental disability. There can be a stigma of disabilities, and families might hesitate to bring it up. For families that are not documented, that can be another concern. And then the overriding distrust that can occur in an education and healthcare setting, or in some cases a violation of trust that has occurred and that historically or currently can continue. Next slide. And so what compounds the problem is that 40 to 60% of children living in low income situations experience developmental delays. So these children are at high risk for having a developmental delay. And we also know, and you've probably are well aware of, that children in families of communities of color are more often diagnosed later and can be up to 2 years later than non-minority children or the majority children. And what we found through lived experience of the families that we've talked with and through literature searching is that there is a lack of parent-oriented, parent-friendly tools that focus on developmental activities that families can do at home to promote their child's development, to help them engage and help them move forward in their development. And so that's where we came to working on this developmental toolkit that have not only evidence-based interventions, but parent-informed interventions from our work with the policy councils in Head Start. Yes, that would be great.
Okay, so what you're looking at, or what you may or may not have had an opportunity to look at, is what we call the toolkit. And so over the past 2 years, we've we developed the toolkit, sent it to parents and sent it to teachers, and got a lot of feedback about things that they wanted to be changed on it. And so what the toolkit is supposed to do is supposed to be giving parents and teachers activities to work on with the kids, whether they have a developmental delay and need to get past that, or they just want to be proactive and know what should they be working on next with their motor skills or their cognitive skills. And so over the past 2 years, we have developed these and revised these multiple times with both the teachers at Head Start and the parent council with Head Start. I think this is kind of a little bit of a duplicate slide, but just to kind of talk about this slide and the next slide, we'll talk about the areas that are within the toolkit. And so the first area that we will talk about is evaluation handouts. The second area is activity handouts. And the third is advocacy handouts. So on this side, you'll see on the top right are the activity handouts. And so we have language activities, motor activities, fine motor activities, gross motor activities, and problem solving activities. And they're broken down by age based on the recommendations of the parents and the teachers. So for example, for like the language activities, there's one page that goes over language activities for 1 to 2-year-olds, then another for 3-year-olds, and another for 4-year-olds. For motor skills, a lot of the fine motor and gross motor overlap for the younger kids. So instead of having a fine and gross motor activity sheet, we just have in general motor activities for the younger kids. And that there's one for 12 to 24 months and another for 25 to 36 months. And then you can kind of see there, then we break it up into fine motor and gross motor. And then problem solving activities, there's 4 sheets, one for each age year 1, year 2, year 3, and year 4. As far as the evaluation handouts, what we were told by the teachers and the parents is that, they get these referrals to different disciplines, but they're not quite sure what's going to happen. So we wanted to have handouts to describe to the parents, if you were referred to one of these disciplines, what does that mean and what will happen during an evaluation visit, to kind of make it more less intimidating to go to after you were referred to one of these disciplines. And then here you see our advocacy in terms toolkit. And so there's a bunch of different things on here, again, based on the parent feedback, but how can a social worker help you? Some things that parents might not know that a social worker can do, or services they can provide to help their child receive their care. A behavioral strategies handout. If parents are concerned about development, how do you get help for your child? That's another one. How to have a difficult conversation. This is more for the teachers, but how to have a difficult conversation about developmental concerns with parents. That was one that the teachers specifically asked for. And then the last is describing a bunch of different medical terms that the parents might hear at one of the appointments that we had just talked about. So for this year, what we're thinking is there are 2 or 3 more, 4 more written materials that were requested at the end of last year. You see them down there in the green box. So one would be understanding IEPs in the 504 process, social emotional development from ages 0 to 5. So we have to decide if that will be one handout or multiple handouts, and then how to manage challenged behaviors. And I think the most fun thing that we think we might do is convert the written materials into animated videos. So one of the things we heard from parents is that they get a lot of materials, and it might be easier to watch a video on, for example, how to promote fine motor skills or how to manage challenging behavior. So we were thinking about using an animated program to then create videos to describe the same thing that they could get in written material, so that they would have a preference then to meet the learning needs of different populations and different parents. So that would be the big things for this year. So that would be step 1 and step 2. Step 1 is making the additional written materials, and step 2 would be making the videos. Step 3 would be to disseminate the new material and then get more feedback from both the parents and the healthcare professionals and the teachers to get their feedback on how helpful or changes that they might want within the materials, and then to evaluate satisfaction with the materials and figure out how to disseminate them, especially with having videos. We started to think about that with the last year with the Head Start Policy Council. So we have some ideas, but would love to problem solve with you all about different ways that we might be able to do that. So if you're interested, and hopefully you're interested in the project, there are some roles that you kind of probably figured out from our presentation so far, but developing written materials and videos, communicating with policy partners. We often meet with them and get great feedback from the Head Scout teachers and the policy partners, to develop and implement a dissemination plan, and then evaluate satisfaction with the tools. The time commitment will meet between 3 and 5 on Thursdays, so pretty similar. And then what we were thinking about the project timeline would be to, in the beginning, the September and October, we would develop the written materials first, send them to get some feedback. And in the meantime, we would start to work on the animated videos for the next couple months. And then in March and April, collect some satisfaction data. And really throughout the process, what we were thinking is we would make one video, send it for feedback before we get too far along in the process as we develop additional videos. So that would be our timeline. Our policy partners, as you probably guessed from our presentation, are the disability coordinators and the teachers from Head Start. So we work with 2 separate Head Start agencies, and then the policy councils from both. And now we'll take any questions that you might have.
Karen, we have one question up here from Brandy.
Okay.
Could you share like your meeting schedule setup?
Yeah, your logistics for meeting, and if there's any meetings outside of the 3 to 5 time.
The only time we would have meetings outside of the 3 to 5 time would be is if we needed to meet with the policy council or the parents outside of that time. So last year, maybe there was 2 meetings that were in the evening to meet when the parents meet. So the majority of the time will be Thursday, 3 to 5. We were thinking a hybrid, some virtual, some in person, depending on who was in the group. And if you were in person on the day of the team meets, or if you're at home, or, so we would kind of work with that. So probably a hybrid approach, some in-person meetings for everybody, and then some virtual.
We're open. We wanted to discuss it with the group and the members of the group. We also recognize that Head Start has moved all of their meetings pretty much to virtual. So for our policy partner meetings, those will be only virtual.
Other questions? Great. Well, thank you, Karen and Karen.
Awesome. Thank you.
Thank you.
And if you guys want to hang on for
Like to
just
see
one
them.
moment, after Karen, yep, and then I was going to go onto Canvas and show you where, maybe I'll go onto Canvas. It's hard to say because my Canvas, I might have to play the password game. And we all know that's not going to work well. Ooh, it's not going to. This is why saved passwords are where it's at. Actually, instead of this, I am going to ask Bethany or Kavya if either of you can share your Canvas screen for today's session.
Yeah, I have Canvas pulled up.
Yeah, if you could share, Kavya, that would be awesome.
Yes, I can do that. 1 second. Okay.
Yay. Okay, hold on. Let me move us out of the way. Oh, we did see it for a second. Yep, now we do. Hold on.
Okay.
What did I do? What did I do wrong? Why is it like doing this? Click this. Click this. No. Click this. Nope.
Okay.
This guy. Ah, there's Karen.
We can
Yay,
see
okay.
it virtually. Can
You
say
were
them?
probably real big for a second, Karen. No, you're good. Okay. So Kavya, if you can scroll down to today's project introduction session, you will see everything in there, except I still need to upload Allie and Lisa's team overview and presentation. So everything is in there. If you need to re-review, obviously this session has been recorded. So if you want to hear it again, I will also add the team leads email addresses to this. So if you have other questions, and then if you scroll just a little bit further, Kavya, the activity is in the Canvas module. So this is just a reminder of the activity. So if you scroll back out over into modules, instead of doing a, how did we do today? How did you like this session? You don't have to do that for this session. You do this SEBM project preference survey. Okay, and then this will be due next Thursday at 11:59 p.m. And I've locked it until 15 minutes from now, but I will go unlock it if you really need to. If you're like me and chomping at the bit to put in your, but I don't, it's not first come, first serve by any means. So take your time. Thank you, Kavi. I appreciate that. It really will only take you a few minutes. And then you just put in my first choice team, my second choice team, my third choice team, and then a little brief description of why you want those teams. Okay. The only other thing I wanted to circle back on, unrelated to SEBM, but related to Lend in general, is making sure you're reminded. I know last week during orientation, we covered so many things so quickly, especially on Tuesday, making sure that you're filling out your self-screener for COVID. And if you have any symptoms, any of those symptoms, hit yes. And if you hit yes, your next two steps are to call 803-SAFE, follow their instructions, and to email me, Jen, Jay, and Vicki. Okay. I am some of your managers, so I will automatically get an email if you've called 803-SAFE, but not for everyone, right? So like Katie, I'm not Katie's manager. I'm not Brandy's manager, so I won't know. So you do have to do that extra step of emailing us. And do not come to campus with any symptoms. Just know that you always have, if you're waiting for a test, if you're doing an at-home test, whatever, do not come to campus with any symptoms. You don't even have to wait for us to email you back. Just stay at home and join on Zoom if you feel good enough. Okay. And we do have to really strictly follow the COVID procedures from Cincinnati Children's. And I'll be honest with you, they've changed about 42 times in the last 2 years. I've gone to get my at-home tests. I've gone to get in-person tests at about 6 different locations in Cincinnati Children's since 2020. So just listen to what they tell you on the 803-SAFE line, do whatever they tell you, and then keep us posted. And we know people are going to end up testing positive this year. So we will keep it as private as possible, but just make sure that we know. Also, don't join if you really don't feel good. Okay, take it easy. Yeah, Julie.
Maybe I just made the assumption that it was full clinic only, or is it full?
It's anytime you're on campus. Anytime, yeah. So that Julie's question was, is it for just if you're going to clinic? No, it's anytime you would have a Lend day. So if you're assigned to be here Tuesdays and Thursdays, it's every Tuesday and Thursday you need to do it. Even if you're just going to be in this classroom. Yeah, Michelle.
I just need help accessing that on my mobile phone. I don't know where to report that. Like I tried to look today to do that and I couldn't find where to do it.
Yes. Yes. In Canvas, in the welcome, there is a whole little part that says COVID resources. I believe it's the last two in that list. One of them is actually the link to the self-screener, and another one is the way that you can add it to your mobile phone to do an alert every day. And I think Griffin had also figured it out, so he might be a good support system for you too. I think what's challenging is honestly, if you have to be on the VPN. If so, right? Like, is anybody going to correct me on that? I feel like you have to be on VPN. Somebody's raising their hand. Is that you, Jay?
I feel like if you go through the link, you don't have to. Because it's like a COVID screen dot something.
Okay.
I have been doing it. I couldn't access it until I had my email access. So that didn't happen until today, and I had to sign in order to do this COVID screener.
I thought you had to sign in to do your COVID screener. Okay. Okay. Jay, were you saying something?
Yes, it's a question in the chat.
Oh, okay. Oh, Karen, the first day that SEBM team groups meet is September 22nd, I
I
believe.
was gonna say, I think I just found it on Canvas.
Oh, okay.
Thank you.
Yeah. I had to look
Yeah,
at my calendar. Yep,
With the
22nd.
COVID thing, I was just going to say the QR code, once you have it in your phone, one of my colleagues taught me this, you don't need the thing that you scan, you can just go down to past scans and it's there. So if you scan it in your phone once, you can go to your history and get it that way. That's the way.
Okay. I do think that it is tied to your CCHMC account and you have to find a way to log in. So for those of you that are still waiting on your badge approvals, that's probably the issue. Yeah. So we'll get there. Just make sure you don't come to campus with symptoms. Great. All right. Well, that's all we have. So enjoy your weekend. First week. Woo! Yay. Awesome. Well, we'll see you on Tuesday.